Focus MD arose out of my own frustration in the way that I was taking care of ADHD patients and my inability to do as good a job as I'd like to. My own frustration in having my own family members that needed treatment, and we had difficulty finding an evidence-based and thoughtful approach that really met our needs. And knowing from the physician side what those patients were needing, because I was experiencing that myself, led to the genesis of this system of taking care of patients with ADHD. It's really been a journey over about 10 to 15 years of experience in living ADHD at home and then trying to address it with my patients in our practice. And that experience led me to realize that there has to be a better way to diagnose and treat this disorder. You know, a colleague of mine said that we should develop a curriculum called From Curiosity to Competence. And I think that that's really what we try to do. There are a lot of doctors out there who are aware they're not doing a great job with these patients, and they're not exactly sure where to turn for the medical evidence base in order to accomplish improved quality of their ADHD care. We're trying to provide that opportunity for those physicians to go from curiosity to competence. What we really needed was a way to do an evidence-based diagnosis and have time to spend with the patient so that we really got to know them, really felt like we understood the issues they were confronting, whether it was just ADHD or ADHD with comorbidity or some other diagnosis that may be leading to an attention problem. By pulling apart and having more time to spend with patients, we really developed that doctor-patient relationship that helps us, I think, to better key in on what the real issues are and help the patient more. It's old-fashioned medicine, but with a technological twist that allows us to have an evidence base to make the diagnosis. And with the diagnosis made, then we have time to give thoughtful attention to individualizing each patient's treatment so that they get the best possible outcome. As a physician, you want to provide quality care for ADHD patients and have a life. At Focus, we offer you the medical knowledge and the business plan so that you can do both.